And it's time for our weekly checkup with Santa Barbara County Public Health to get the latest on the pandemic here at home. Director Vondo Reynoso joining us on Zoom. Good to see you again. Let's start with boosters for people who have been vaccinated. Pfizer says 6 months after the second dose. The FDA is kind of waffling. Do we need it? Do we not need it? What do local residents need to know about possible boosters?
We are awaiting for guidance from our FDA. So as you know, they are meeting tomorrow, and soon after we will be getting the guidance from both CDC and CDPH about whether the booster shot will be needed or given to the general public.
And then if that were to come, which is expected at some point, people will need a booster shot. How are you ramping up for that? Are we going to have clinics set up again, kind of pop-up drive-thrus like we've seen in the past?
A little bit of everything. We have been in weekly meetings with our healthcare partners to plan for the booster clinics. So we will be messaging that to our community that, unlike before where there was a shortage of vaccines, now with the boosters, you can get it through your healthcare provider at pharmacies. And certainly the public health department will be ready to offer the booster shots to vulnerable members of our community, like the unsheltered, like the homebound, like the seniors in skilled nursing facilities, in congregate living facilities, and like community members in various parts of our county that don't have easy access.
Let's talk about people that have not gotten the vaccine. Vaccine rates right now slightly going up, but obviously you would like to see better numbers. Where do we stand? And zip code by zip code is kind of what you watch, right?
Right. We are excited that we are seeing a slight increase in vaccination rates in most of the zip codes. In particular, we're super excited that those zip codes which traditionally have not had a lot of a good solid vaccination coverage are eking upwards in getting vaccinated. In particular, we're excited that our community partners, together with public health in outreach, we are seeing results in Santa Maria, in Guadalupe, and in Lompoc. And just quickly, we had a wildly successful vaccination clinic at Good Sam yesterday, really applauding our community partners, and in particular, fighting back Santa Maria Valley for the outreach efforts so that we can vaccinate unsheltered community members, as well as there were other community members who sought out vaccination at that clinic last night as well.
That is good news, and I know North County's been kind of lagging behind South County when it comes to rates. When people come in and get a shot now, what's been the big difference? Is it Delta? Is it the fear of this is worse than before?
I think it's a little bit of both. It's worries about the Delta being widespread, and some reassurance now that the Pfizer has received the FDA approval. And I think just the convenience we reached those community members at the perfect time.
Let's talk cases. We see, I guess, I don't know if we've reached the peak. We're kind of at the peak, it looks like, in California when it comes to new cases, at least over the last couple of weeks. Where are we locally when it comes to our case numbers?
Happy to say that we are mirroring the statewide trend of case rates going down. So we are thrilled and very cautiously optimistic that we can maintain this downward trend.
What has been the biggest driving factor in those case numbers coming down and hospitalizations? Obviously, we never reached what we were at prior where it was worse, right?
Right. So we're seeing we're always at that cusp of exceeding our hospital capacity, but good to report that our hospitalization is decreasing as well within the last 2 weeks, about a 34% decrease, with about a 24% decrease in ICU admits due to COVID. With regards to case rates, we are, as I just mentioned, we are seeing a downward trend. And I think that has a lot to do with our vaccination coverage increasing. There's a direct relationship. The more our community members are vaccinated, the lower the case cases, the lower the case trend. And we're seeing that throughout the state as well.
And some of the information you provided from public health, that hospitalization data from the month of August revealed 85% of hospitalized community members were unvaccinated. So that maybe is driving some of the concern for people who haven't gotten the shots. Go get it.
Right. I think that is the take-home message there. The vaccine is protective against COVID, severe illness due to COVID, and hospitalization. So really can't stress that point enough. Being vaccinated will protect most individuals from getting severe illness, hospitalizations, and death due to COVID.
And median age of somebody who is vaccinated and ends up needing to be hospitalized is 80, although still rare because they're vaccinated. Unvaccinated, the median age is 52. So that's pretty amazing numbers there from public health.
It's very sobering.
Yeah. Vondo Reynoso, thanks so much for joining us, and we'll chat again next week.
Thank you.